Who's actually going to benefit from a new dental exam and X-ray chair? Who can safely keep using the old unit? And does the price make sense for a practice that's just trying to stay profitable? Those are the three questions that keep most office managers up at night when they're scrolling through catalogs. Link is in the description if you want to check the product details on Amazon. I spent a few days talking to a couple of dentists, reading through forums where clinicians compare chair ergonomics, and looking at the specs of the American Goods professional dental patient exam and X-ray chair to see whether it truly solves the day-to-day pain points. First off, let's talk about why a chair matters beyond the glossy brochure. In a busy practice, you're moving patients in and out every few minutes, bending over a tray, and trying to keep your own back from screaming by the end of the day. A chair that can swivel a full 360, adjust height smoothly, and keep the headrest in a position that doesn't strain the patient's neck can shave off a few seconds per appointment. Those seconds add up to a healthier workflow and, ultimately, a healthier bottom line. The American model promises exactly that: a 360 swivel, an adjustable and removable headrest, and a high-density foam cushion that claims to bounce back and retain its shape. On paper, it sounds like a decent upgrade over a static, low-adjustment unit. So, who should actually buy this chair? If you're running a small to mid-sized dental office that still uses a chair from the early 2000s, you'll notice the difference immediately. The new chair's smooth hydraulic lift means you won't have to wrestle with a crank every time you need to raise or lower the seat. The 360 swivel is a real time saver when you have to switch between a routine exam and an X-ray without having to ask an assistant to reposition the patient. And if you treat a lot of patients with limited mobility, elderly, special needs, or anyone who gets anxious sitting upright, the removable headrest lets you customize the recline angle, reducing the feeling of being trapped. On the flip side, if your practice already runs a chair that glides silently, has a reliable foam cushion, and your team is comfortable with the current workflow, the American chair might feel like a nice seat-to-have rather than a need-to-have. The price point sits in the mid-range for professional dental chairs, so you're not getting the ultra-premium features you'd see on a high-end German-engineered model, things like integrated patient monitor displays or advanced memory presets. If you're a solo practitioner who only sees a handful of patients a day, the incremental gain in ergonomics may not justify the capital outlay. Now, let's break down the practical strengths I observed after watching a few demo videos and reading the user manual. The first thing that stands out is the high-density foam seat. In the footage, the cushion compresses under a patient's weight, then rebounds quickly when they're lifted, exactly the kind of resilience that prevents permanent sagging after months of use. That's a subtle but important cost saver. You won't have to replace the seat cushion after a year or two, which is something a lot of older chairs force you to do. The swivel mechanism is another win. Many cheaper chairs limit rotation to about 180, which can feel cramped when you're trying to position the patient for a bite wing X-ray. The American's full 360 rotation lets you line up the X-ray tube from any angle without having to twist the patient's head unnaturally. In a real-world scenario, say you're doing an orthodontic assessment on a teen who's nervous about staying still, the ability to rotate the chair smoothly while keeping the headrest in a comfortable position can make the difference between a quick scan and a prolonged, stressful session. Adjustability is also pretty intuitive. The hydraulic lift has a single lever that moves the seat up and down in a fluid motion. There's no jittery click-stop feeling that some older models have, which can make fine-tuning the height a little frustrating. The headrest itself is removable, meaning you can strip it away for a full-body X-ray or replace it with a specialized pediatric cushion if you decide to expand your services. But there are a few practical weaknesses to be aware of. First, the chair's base is fairly wide, which is great for stability, but can be a problem in smaller operatories where floor space is at a premium. If you're working out of a room that's just barely 10 feet wide, you'll need to plan the layout carefully to avoid the chair hitting the wall during a full swivel. Second, while the high-density foam is durable, it does retain a slight memory of the last patient's posture. In a busy morning with back-to-back appointments, the seat may feel a bit softer for the second patient until it readjusts.